For next issues which we'll discuss, this is the vaginal vault prolapse. Vaginal vault prolapse. So for the vaginal vault prolapse, I think it just has to do with, the vagina is kind of like, coming down. All right, this is what, all right, a prolapse. But this one is basically, you're talking about the vagina. All right, yes, mostly we know the uterus prolapse, but we've spoken about uterus prolapse. Now we'll go to the vaginal vault prolapse. So it's still a type of pelvic organ prolapse, you understand? So this one occurs when the top of the vagina, that's the vaginal vault, loses its support. It now collapses into the vaginal canal. So I think I didn't actually get the right. Yes, this image is kind of like nice. Okay, so top of the vagina is collapsing right back into the vagina. You understand? So it's commonly seen in individuals who had hysterectomy. Do you understand? So they have removed your uterus. Can you see that here? The uterus is not here. So most of the times, this is for people that have had surgeries that they have removed their uterus. Do you understand? So the uterus was serving to hold the vaginal walls. So they remove the uterus now. So the walls are collapsing because the support is reduced. So causes, it could be weakened pelvic muscles. It could be somebody has had vaginal birth, so there's like some damage to some structures. It could be aging or menopause. It could be chronic coughing. When you cough, your pelvic structures are stressed, heavy weight lifting or obesity, previous pelvic surgeries. All right, so symptoms to watch out for: if the person is having signs of heaviness or fullness, all right, in the pelvic region, feeling like they are sitting on a ball, that means they are sitting on their organs. A bulge or lump in the vaginal opening, lower back pain that improves when you are lying down. Okay, urinary issues like frequency, urine leakage, incomplete emptying, bowel problems. All right, then when they are having pain, there's a lot of when they're having sex, there's a lot of pain and also abnormal vaginal bleeding. Okay, so diagnosis is what? Pelvic examination. All right, urodynamic testing if urinary symptoms are present. Also imagings. All right, you have to do imagings to look into the pelvic structure and see if there's any issues, complications coming up. Treatment, lifestyle changes. All right, like weight management, pelvic floor exercises, pessary devices. All right, it's a removable device inserted into the vagina to support the pelvic organs. Then physical therapies, they have to do all those exercises, pelvic floor exercises and all those Kegel exercises. Then surgery, they can actually reconstruct that area, or they can do a surgery to suspend the vagina, kind of like tie it back. All right, it's a surgery we actually spoke about. They tie the vagina back to the what? Sacral, spinal bones. So that's just what this vaginal vault prolapse is. All right, is rare, only for people that have actually done a surgery and they have removed their uterus. Okay, so that's just what it is: vaginal vault prolapse.